السلام عليكم ورحمة الله وبركاته. لو بس على الشات زملاء يطمنوني الصوت واضح ولا لا؟ واضح واضح واضح، ما شاء الله كله واضح الحمد لله. طيب ما شاء الله في فلض من واضح. ربنا ييسر الأمور. بسم الله الرحمن الرحيم، والصلاة والسلام على أشرف المرسلين سيدنا محمد صلى الله عليه وسلم. اللهم علمنا ما ينفعنا وانفعنا بما علمتنا وزدنا بفضلك علما. نرحب بكم جميعا في هذه الأمسية الطيبة، في هذا اليوم الطيب يوم الجمعة. نجتمع جميعا من أجل إن شاء الله أن نتحصل هذا العلم من المدينة المنورة. أرحب بكم محدثكم محمد مصطفى محمود، أحيانا يختصروها ويسموها دكتور 3M، وأنا المدير التنفيذي لمعهد مدينة المعرفة للقيادة والريادة مايل، مدينة انستيتيوت فور ليدرشيب اند انتربرنورشيب. والمعهد متخصص منذ عدة سنوات في تقديم برامج لتطوير القيادات، زي البرنامج القادم إن شاء الله لتطوير القيادات، إن شاء الله هيكون في مارش 19 to 24 High Performance Health Organization. احنا سعداء اليوم ان احنا نستضيف اول المتحدثين في سلسلة الويبينارات اللي بعنوان e-health care، وهذه سلسلة من الويبينارات سوف تستمر إن شاء الله. This series of webinar, let me convert a little bit to English. This series of webinar e-health care will continue starting tonight every week until the big event which will take place in Medina 19 to 24 of March, inshallah, which is called High Performance Health Organization, and this will be the 5th edition of this event. The event of tonight is sponsored by two main sponsors. The first one is tip.com, and this is an online medical community for a virtual clinic, and it's a very innovative solution which will transform the healthcare delivery. And the other sponsor of this event is Digitum, and Digitum is a main solution provider and IT solution provider, so not only in the healthcare sector, but in many other fields. Our speaker tonight is Mr. Tariq Hakim. Mr. Tariq Hakim is an IBM consulting he works in IBM Consulting as a management consultant in the healthcare area, and he has a bachelor in a master of science in health informatics and the Bachelor of Science in Biomedical Instrumentation. Tariq Hakim, he looks very young, but he carries 18 plus years of professional experience. National Health Information Center e-health strategy project manager, and National Data Governance project representative, National Platform for Medications and Medical Devices project manager, National Platform for Health Information Exchange System project leaders, e-health interoperability standards project leaders, and global digital health partnerships and official representative in GDHP. We have about maybe 45 minutes to 50 minutes for the presentation. Following the presentation, we'll be happy to answer any of the questions. Please write your questions in the chat and send them to moderators, only to the moderator. So send your questions to the moderator in the chat, and at the end of the presentation, inshallah, we'll try to read them and answer them according to their first come, first serve, as they said. So without taking much time from Engineer Tariq, I would like to leave the floor to him, and he can now take control of the share and start his presentation. Welcome, Mr. Tariq Hakim, and our greetings from Al-Madinah Al-Munawwara. And we have a large crowd who are very excited, inshallah, for your, to listen to your presentation.
Thank you very much, Dr. Muhammad, and thank you very much, Mail Medina, for inviting me. I'm really pleasured and honored to be in this event and presenting to you. Thank you very much, the audience, all of the audience, for their attendance. I wish I can deliver you an insightful, a fruitful session today. Now I'll be sharing my screen. Okay, can you see my screen, Dr. Muhammad?
Yes, I can see it. And by the way, the same presentation is delivered on YouTube simultaneously. So, and the link will be shared in the chat. Anybody would like to share the link with any of his colleagues so other people can follow us through the YouTube, we'll be happy, to welcome them. So I will ask Faisal, please put the YouTube link on the chat. Okay, go ahead, Mr. Tariq.
Fantastic. Okay. Now, so today we're speaking about the data governance. We're going to focus from the healthcare aspect. Data governance is really relatively, I would say, a new concept, especially comparing to the other concept that existed before, like the IT governance and maybe the data management. So here we're going to focus mainly on 4 areas. I would start with why data governance. What actually ignited data governance, and why are we here today? Why are we speaking about data governance? What are the real issues and regarding the data problems we're having that led us actually to data governance? Then we're going to talk about the definition of data governance. There is no single definition like we're going to see, but we're going to address some definitions. We're going to speak about the operating models. We're going to speak about the frameworks to implement data governance. And we're going to differentiate between data governance and some other closely related concepts. We have data management, we have IT governance, we have actually also information governance, and some of the other frameworks. All of them somehow are interrelated, but our focus today is purely data governance. Next, we're going to go into the goals and really the benefits of the data governance. What are we aspiring for? Then we're going to conclude with the National Health Data Governance Program. There was a project that has been done by the Saudi Health Council and the FAB, and the deliverables have been approved by the Saudi Health Council. And I'm going to shed some light about this project and what has been delivered in that project. So we're going to start now with why data governance. It's no surprise that actually data growth is growing tremendously in every minute and every day. There is a tremendous growth of data, and this will also continue and it's keep accelerating. We can, of course, contribute this to the computing power, or we can contribute this to the social different media and the different platforms and applications available today, and no one can predict how tremendous it's going to be. Now, what's really interesting here, I'm going to show my pointer. What's really going to interesting at 2014, at the peak of the data growth, because of the cloud and the big data, there has been an implementation of data governance, mostly because of regulatory compliance, because the regulator always forcing many institutions to comply with their regulatory requirements, for example, for privacy, for cybersecurity, whatsoever. However, this actually has shifted after 2014 into regulatory and innovation, because entities now would like to differentiate between the high quality data for them and the low quality. And this is really the core of data governance. This is what data governance come really in hand, into re-evaluating the data and really making sense of the data in their business need and perspective. So pharmaceuticals company or a regulator or even a hospital might have a different data governance than from each other, because their focus on quality differ. That's why after 2014, there has been really a focus into the governance, not only because of regulatory, but also for innovation and really to make use of the data. Now, with the more data, there is always, of course, a cost. Data quality is not always suitable for purpose. We all know that data quality might not be always the best. There is an issue, a great issue of data quality. That's why we always need to use data standard as much as possible and abide by the different data quality frameworks. Data innovation is missing. And this is especially prevalent in healthcare, in which we can define one element differently. Many institutions, even in the institution itself, one data definition can actually vary between one department to another. We can have too many sources of the same data. This will make the data inconsistent. We can have too difficult or slow to get innovative data into an acceptable platform. And then we can have an inconsistent reference value. That's why we always need to use standards whenever we can. Now, typical root causes for this is fragmented data. You can have data from, like I said before, multiple resources. There is an issue of poor data accuracy and consistency. So data is just not consistent all the time. Sometimes data is accurate, sometimes it's not. Sometimes it's consistent, sometimes they're not consistent with each other. We can have an issue of latency, especially when you're moving data from one site into another. And then we want to make a compiler report, and report is not synchronized very well. This will really create a timing issue. We can have silo solution. We can have a multiple databases for a single system. This will absolutely create issues. You can have a poor synchronization. You can have a non-scalable IT infrastructure. For example, if the IT infrastructure is not scalable, when I want to move my data from one infrastructure into another, then this will really create an issue. You can have a lack of self-sufficiency, in which always an analyst or a business user will have to go to the IT to do their work for the data. So these are some typical root causes for the issues we have. Now let's talk about the perspective of healthcare. How does data governance falls into issue of the healthcare? We all know that bad information is killing. I'm referencing here the United States, American at a record rate. Medical mistakes kill over 250,000 people each year. This is the third leading cause of death behind heart diseases and cancer. And this is a study has done by Johns Hopkins. Now, even though the United States has the most expensive healthcare in the world, they have the most advanced equipment, they have the most advanced medicine, the best trainees. However, the US actually, in a study, came the last out of 11 civilized nations in terms of healthcare. Now, what is the US healthcare problem? It's not actually due to training, it's not due to equipment or medication. It's actually failure to get the right information to the right people at the right time. And that is, caregiver must have accurate, current clinical information in order for them to do their job properly. And this is actually the core of data governance. This is a purely data governance issue. That is actually a life or death consequences. Of course, it can be fixed. However, this actually needs education and tools. It needs collaboration with experts. This actually needs to gaining executive management support for a data governance program. Now let's look at some data governance, I would say, failures. In 2015, the LifeBridge Health revealed that electronic health record of 500,000 patients have been compromised for over 1 year. At 2017 as well, the Molina healthcare breach, which have compromised 4.8 million patient records. Another institution, the Mid-Michigan Physicians Imaging Center, potentially over 100,000 patients patient health information was breached. The center was ended up paying $75,000 fine. And one oncology center has a breach in 2015, exposed more than 2 million patient records, and they were fined $2.3 billion. And in 2015, a number of organizations were hacked by some hackers who penetrated the organization and stole possibly over 37.5 billion records. Now, all of these organizations probably didn't have the proper data governance in place, because cybersecurity is an integral part of data governance as well. They didn't know where all of their protected health information and personally identifiable information, and they didn't took the adequate measure to secure that valuable information. Now, we shed some light regarding why are we doing data governance. Now, we're going to come up with some concept of data governance, some operating models, some frameworks, and the other related concept of data governance. So what is really data governance? There are really a number of definitions. However, all of them carry the two components of people and processes and also technology. So let's look at the first definition. It's actually the exercise of authority and control, planning, monitoring, and enforcement over the management of data assets. The planning, monitoring, and enforcement is really more of a management and operational. So it's more about people and processes, while actually the management of data assets, this is more technical. Other definition could be the decision rights of accountabilities of information related processes, according to agreed upon models, which describe who can take what actions with what information and when, under what circumstances, within what method. So this definition carries more about the what, who, when, and the where definition. The decision rights and accountabilities have the people and processes part, while the information related processes are all more technical. The last definition is the most, I would say, comprehensive one, which is referred to people and organization capability. This is purely people and processes and controls and technology and architecture. So these are just a different data governance definition. There is currently no uniform definition, but I would say the last one is the most up to the point and most comprehensive definition. Now, DAMA, the Data Management Association International, it's a non-profit organization, has actually developed a framework for data governance, and all of the accompanying elements are shown in here. Maybe what's missing here in DAMA is the privacy, especially from the healthcare perspective. Privacy is really of significant. Now, this model is really interesting. This is an abstract model that is called level 0, because here it shows the relationship between the business and technology in data governance, and that's what the core of data governance is. So in order to implement data governance, there will be a business strategy that will have different initiatives, and these initiatives then will be implemented. Now, the implementation of these initiatives could be business or could be technology. Business will always identify the requirements, prioritize, refine, and approves whatever requirements they have. And the technology people will always implement those requirements, but because of their technical capabilities, they will always inform of the capabilities and trade-off and constraints regarding whatever businesses require. So there is always this flow of communication between business and technology in this model. So this is the most, I would say, abstract model for implementing data governance. Now, the next model, which has the 6 boxes here, it's called level 1. The first box is the data governance strategy. Now, what do we do in this data governance strategy? We do our data strategy, and we align it with the strategy of the enterprise or the institution. Next, we have the data governance organizational structure. Here we define who will be involved in the data governance, what are their roles, what are their responsibilities for data governance. Then we will have data-related rules. This covers everything regarding standards, policies, metrics, education regarding the data. Then we will have communications and data governance tools. How do we communicate this governance across the enterprise? This is what's specified here. Then data governance processes, the processes needed for data governance. The last box here, if you can notice that this box here is actually outside of the other remaining boxes, because this box actually is mainly technical. This involves all of the technical initiatives like the architecture, data warehouse, business intelligence. This could be actually outside of your operating model of the governance, but somehow it's very interrelated and it's very much affected by whatever governance that is being made. So these are the 6 boxes for a level 1 operating model for data governance, what you need to do to implement your data governance. Now, we have to differentiate between another concept, which is data management. So data management is actually not the same as data governance. Data management is the business function that actually develops and executes the plans, policies, practices that acquire and projects that acquire, control, deliver, and enhance the value of data information. So data governance in ensuring the data is properly managed. It's actually develop the guidance and ensure that guidance is being followed. So this slide just shows the difference actually between data management and data governance. While data management actually the actual execution of the plan and policy. Now, another concept here that has been around for a long time is the IT governance. So in simple ways, IT governance is actually sees just to align the business objectives with IT strategy in order for the enterprise to achieve its business value. Of course, the most common prevalent framework for IT governance is the COVID. There are many other frameworks for IT governance, like for example, the ISO standard, but the COVID is the most comprehensive one for IT governance. However, I just wanted to show the difference between IT governance and data governance. There is also Another thing developed by AHIMA, which is called information governance. Now, what is information governance? AHIMA defined it as an organization-wide framework for managing information throughout its life cycle, supporting the organization's strategy, operations, regulatory, legal risk, and environmental requirements. Of course, as we all know, AHIMA is the a non-profit health organization that develops standard and guidelines for health information. Another definition for information government is how an organization maintains security, complies with regulation and laws, and meets ethical standards when managing information. AHIMA also developed a model for information governance. This is the model developed by AHIMA to govern the adoption model, it's called. So AHIMA considered the information governance is the overarching governance, and it considered data governance and IT governance as a component of the overall, I would say, information governance. So these are the different, I would say, definitions and concepts regarding data governance, information governance. Now, of course, and as for healthcare, we always have to abide by different standards there in order for us to achieve the proper data governance. All of these standards actually do contribute to the data governance because they standardize content, they have standardized the model, they standardize the code and terminologies, like for example, HL7 Fire, the HL7 International, SNOMED CT, the LOINC, the ICD-10, the IHE, all of these contribute to our healthcare data governance, and we must always use this standard in our governance model. Now, we finished the why are we using data governance, and we have shed the light of what is actually data governance. Now we'll go about the goals. What do we aspire and what's our main goals and achievement of data governance? So, of course, we want to enable better decision making, and the value of data is actually measured by the value of the business decision they make. They reduce operational friction, they protect the need of all data stakeholders, they treat management and staff to adopt common approaches, to have a consistent common approaches to managing data and resolving issues by using governance. Of course, they reduce cost and increase effectiveness through the coordination efforts, and then they ensure the transparency and clearance of all processes. However, we are in healthcare. I would say the most important goal is to harness the power of data to enhance decision making and steer the health ecosystem toward its strategic objectives. This is what we aspire to achieve by implementing a good data governance in the healthcare ecosystem. Now, these organizations here are the early adopters of data governance. These are the ones that adopted data governance since 2011. Now, this have been due to the regulatory compliance and because of the nature of their businesses, because they are multinational and they have a very critical businesses like in finance, pharmaceuticals, and we can see here some healthcare entities like McKesson, United Healthcare, Alberta Health Services. So I'm showing here the early adopters of health governance here internationally. Now, we spoke about goals of data governance. Now, I'm just going to shed some light regarding the national data governance project that took place. At first, we actually identify all of the key stakeholders in the health ecosystem. So we have a number of stakeholders, and they have all of them have to be considered whenever we develop a national, I would say, data governance framework. We have the CDC or WIQAYA, we have the different healthcare provider, we have the Saudi Patient Safety Center, we have the Saudi Health Council and National Health Information Center, another different entities for providing healthcare. We have SIBAHI regarding the standardization for hospital and recognition. We have the FAB for the procurement. We have the CCHI, the Council for the Health Insurance, and then we have the Saudi Commission for Health Specialties and the Saudi Food and Drug Authority. Really, we have to involve all of the key players in the healthcare sector. And of course, this is not an exhaustive list because there are other, I would say, not directly impacting or not delivering healthcare, like for example, SADAYA, they are the or the National Data Management Office. They actually do artifacts and deliverables regarding the data management and the national governance, all of national governance issues. But somehow we have to tailor all of these deliverables to healthcare. Now, we also identified the whole healthcare ecosystem data domains that actually matters at the national level. So and each one of these domain have different entities beneath them. So we said the patient, there is the provider or the entity, the different healthcare organizations. We have the clinical information, like for example, the diagnosis. We have the practitioner, all information regarding practitioner. We have the diagnostics, all information regarding the laboratory, regarding the radiology. Now we have also the financial information regarding the eligibility and insurance policies. We have the different workflow, the engines regarding referrals, requests, and all of the other transactions that have workflows. We have information regarding the medication, information regarding the medical devices, and last but not least, a public health domain. And then we developed a national operating model that depict the different roles and responsibilities for the previous entities. So we said that there should be a data governance sponsor that provide the guidance and make overarching decisions, sets the vision, direction for all strategic issues. And then we should have a scientific committee that set the strategic direction, provide review, that approve actually the national policies and standards. And then we should have an executive team that provide the direct oversight and management for data governance activities. Then we said there should be a data domain owner, like for example, public health should have a data domain owner, insurance should have a data domain owner, medical devices should have a data domain owner. All of this has to be specified in detail. And then we specified the data custodian and data steward. So in simple words, data custodians are the one responsible for the data platform for all of the technical aspects regarding the data, while data stewards are from the business aspect. They are responsible for the data standards policies. They're responsible for the data quality, the data accuracy. And then last but not least are the data consumers and data users. Data producers are the one producing the data, and then we have the data consumers who are actually consuming those data. So this is a typical governance model, and we apply it into the national healthcare. And as we can see, at the top of the pyramid here, it's more strategic function, while in the bottom, it's more operational. Now we took an example of, if you want to detail this, for example, for the finance, and this is just for the sake of an example, but the next step is actually to detail this along all of the data domains I shown before. We said, for example, that the sponsor could be the Saudi Health Council. It could be now, for example, the VRO, the VRP. And then we should have the scientific committee and executive team. And then we specify the data owner. Data owner could be, for example, the CCHI, the Council for Health Insurance, or the FAB for the procurement. Then we said the data custodian, the technical arms from the data could be the CCHI or FAB, or could be also the NHIC. Then we said the data steward, the one who are setting really the standard regarding insurance and have all of the data. These are the third party or the insurance companies. And then the data consumer and producer, in this case, they are mainly the health data provider in the healthcare ecosystem. So this is in summary the project that was done, and of course there has many deliverables, and many deliverables actually at the national level contribute to the national data governance, like for example the Saudi Health Council data dictionary, the minimum data set by the FAB. This is more of a metadata description. The e-health interoperability standards, all of these contribute to the national data governance. And this is one phase, and still the next phase is to actually detail this model to all other entities. So that's it from my side. This was hopefully concise presentation regarding data governance and how is this related to healthcare, and what is the operating model, and how can we implement this into our entities, and the project that has been done regarding data governance. So back to you, Dr. Muhammad.
Now, back to me. You got us so excited with the introduction about the challenging facing the data governance and the ecosystem, the stakeholders is so complicated set and multiple stakeholders. But we are really excited to know a little bit about how did you really develop the governance model? How did you put it on ground? How did you manage to get all of these stakeholders to speak to each other? How much progress have you made so far in establishing this governance? If you can just, I would like to take advantage of the remaining time to get more, insight about what really happened on the ground.
Yes, absolutely, Dr. Mohammed. It's a fantastic question. Data governance, like I said before, it's actually a program. It means there has been a project, but it's a journey, and this journey keeps going on. At first step, like I said, we develop an initial model, but still, this model needs to be detailed, and there are other deliverables that need to be developed in alignment with the National Data Management Office that actually develop data management standards at the national level. But because each sector is unique and healthcare is very unique, so we have to develop these standards according to the context of healthcare. So there has been a project, and mainly this project has been with different representatives from the stakeholders during the project. And obviously this project was actually subcontracted by a vendor, and many deliverables have been delivered. I just shown you here some really basic deliverables, but certainly there are more details than this. But this is the key stakeholder identification in which we have identified during our meetings. So we mentioned that those stakeholders must exist in all of our health ecosystem, because our health ecosystem is really unique, in which you have multiple players in the system. You have, for example, MOH, who is being a provider and a regulator now, and now it will shift into being a separate regulator. So the health ecosystem is very much complex, and we have to take into account all of the stakeholders in our healthcare ecosystem.
Very good. In fact, Mr. Manhal, while you are showing this, mentioned that what about Gulf Health Council?
Yeah, I would say it's that's a great suggestion. Actually, I know that the Gulf Health Council there has been actually many collaboration. Especially, I know regarding the unified health record, they wanted to standardize somehow the unified health record along with the whole Gulf. So definitely, I would say that's a great suggestion to include them at the key stakeholder as well. That's a very great suggestion, actually.
Okay, if you just click on question and answer, we have about 8 questions. If you like, to read them yourself and go through them.
Okay, sure. So, is data governance a project that has activities to be implemented, or as part of develop the organization, culture, organization, policy, and procedure? Okay, that's a great question from. Okay, so the question is it like a project that be implemented, or is it part of a culture organization? So data governance is actually should be developed at the institutional level. So I believe that each organization should do data governance by using the different operating models I've shown. But the project I've shown here is actually the national data governance. So there is a national data governance that is done at the national level, but also each organization should do its own data governance to deliver as much quality as needed from its side. So it's actually both. It's and is it a project? I would say it's a program. Really, it's not really one project, because it's a journey that continues along the way. I would say that data governance never ends, because it always aligns with the business objectives. It's always aligned with the data management initiatives. So it's a journey, and it's really a program that includes many initiatives and many projects along the way. So I have another also question, a great question. Is data governance implementation should led by IT? That's really a great question. And I've shown this here. I'll go back to the slides. Yeah.
The pyramid.
Yeah. Okay. So it's actually, so this one regarding the governance model as a whole, not the specific project. As I said here, the data governance actually is a mix of both players, business, people, and technology. So both of them should contribute to data governance. and both of them should actually lead the data governance. Not really, this is dependent on the organization of who would be appointed to lead this, but both of them will actually contribute to the data governance, because the business will have the business strategy, the technology will have the technology, like I said. The business are actually responsible for the outcome of the technology always. But the technology people knows with the capabilities and the constraints of whatever business requirements. So I would say that both of them are really leading data governance. Data governance is not really, this is also might be a confusion for many people, that data governance is a very technical aspect and only technology people should lead it. I would definitely say no. Data governance include both business people and technology people as well. So is the data governance considered a tool to reach to strategic goals? So yeah, it is actually a method to reach to a strategic goal, but I'm just conscious about using the word tool as making data governance a small chunk of the whole picture. Data governance is really, like I said, it's a big program that involves the continuous collaboration between the business people, the IT people. But of course, definitely, it's. The ultimate vision is for data governance is to reaching the strategic goal and have proper, I would say, data quality, proper data management, and to deliver the strategic objective of the organization. Okay, so where are we currently from this model? This will actually vary from one institution to another. One of the things that we actually did during the National Data Governance project is that we actually did some maturity assessment across some organization, and this actually has varied tremendously from one organization to another, and this is really expected. So where are we currently? It really varies from one provider, from one entity to another, because each entity have its own, I would say, capabilities, have their own processes, have their own maturity as well. Okay. Okay, there are some questions here that are not much related to data governance, so I'll skip those. Data monetization. Okay, that's a great question here. As healthcare cluster is emerging to become a non-for-profit healthcare organization in Saudi Arabia, what advice would you give them? So in the perspective of data governance, of course, the best advice we would recommend is to abide by all of the data governance best practices. Make sure that governance is actually an integral part of their organization from the bottom up, and make it part of their strategic direction. Okay, there is here another important questions. Okay, the failure of the data governance you mentioned is related to cyber attacks. So is cyber security governance and information security governance part? Yeah, I would say so. Data governance is making sure the data are really governed. And cyber security is really an integral part of information governance. So we can always think of governance as the umbrella that have everything beneath them, and definitely cybersecurity is a very important aspect of data governance. So here I have another question: what is the difference between data governance and data management? So like I mentioned before, there is always a thin line, and it really depends on your interpretation, but I will show the slide here because I have this particular slide, the difference between data management, data governance. So data management is actually the business function that executes the plans and policy, and data governance is ensuring the data is properly managed. So I would say that data management could be part of the data governance, because data governance, in order for you to data governance, to ensure you have a data governance, you must ensure that you have a proper data management in place. Okay, so I have another great question here. How do you propose to kickstart this initiative in medium-sized healthcare? What would be the few things that I should do with the laundry list of things you have shared? I would say this is the most, this is the most implementable. It's very simple. It's really practical. So defining all of those and putting them together, defining your data strategy and aligning your data strategy to the business goals of the enterprise, defining who will work, the team of the data governance, who will work in data governance, what's their roles, what's their responsibilities, defining the data related rules, the standard, the policy, the education, the metrics regarding the data, the communication and data governance tools. How do you communicate this governance across the enterprise, across your institution? And then you have the data governance processes. What are the processes for the data governance? Then lastly, this is the data management initiatives, which could be, like I mentioned before, outside of your governance. This is actually more of pure technical initiatives you have. You must have your architecture, for example. You must have your conceptual architecture. You must have your data architecture, your logical architecture. You must have what's your data warehouse, what is your business intelligence. So all of this, like I mentioned, it's a continuous journey, but you can definitely leverage these tools to get started to the proper data governance. Yeah, so maturity assessment, I'm not aware of a single maturity assessment, but there are definitely different methodologies, different assessment to assess your maturity in terms of the data governance. I'm not aware of them at the top of my head, but I'm sure there are lots of maturity assessment methodologies used. We used one during our project to assess the maturity of the different organizations regarding the governance maturity. So there is an interesting question here. Would you agree that healthcare organizations should develop terms of references, manuals, internal reference playbook? So uh, I would say yes, they should develop. Of course, I mean this is part of a good governance as well. That each healthcare organization would develop terms of references as an internal reference playbook, which is an integral part of a good governance. The same question I had, who should lead data governance, seems like a debate. Is it business or technology? Like I mentioned, it's actually the collaboration of both. Just like actually COVID, everybody thought that COVID is a really technical framework, while it's actually not. It's making sure that the IT is achieving the business of an organization. So not necessarily led by technology by any means. This is a collaboration, an ongoing collaboration between the business and on technology. And really it depends on the situation of the organization, whether they want to point business or technology responsibility. But I would focus again that it's really a shared responsibility between both business and technology. So, Doctor, I think I covered most of the relevant question. If you have anything else, let me know, please.
Okay. Have you reached the end of the list? Yes.
Yes.
Yeah. There is also in the chat, there was few. Someone was asking, are the clusters has been involved yet in this initiative?
Well, the cluster is moving in a very dynamic way, I would say, but we have been in contact with, for example, the health holding company and the people who are involved with the cluster as well. But like I said, the model we developed is that has been developed is very much at an abstract level and very generic. So regardless of how the cluster will evolve, it will be applicable to whatever model that we developed for the cluster. And like I mentioned, this is just the first of the journey. It's a journey that never stops, and the model developed is in a very abstract level right now.
Yes. Also, Ashid Data is asking, is there any certification programs for data governance that you are aware of?
For data, I'm not really aware of governance certification program, because I know for sure in COVID they have one. In data governance, like I mentioned, it's a relatively new, I would say, concept. So I'm not really familiar with something just like COVID for certifying data governance. Actually, I'm not aware of any right now. There is DEMA, of course. Maybe if you try DEMA, DEMA they might have something for the data governance, because the DEMA is and also National Data Management Office, SDAIA, they actually took DEMA and they consider it as the reference for data governance. So maybe DEMA have some specific certification for data governance.
Yes.
That's what I suggest.
Yeah. In fact, I see two of the participants, one of them from San Francisco and the other one from London. And they asked questions, and I just hate to, to finish this without entertaining them. Dr. Manhal Dakhlullah from London was asking, would you agree that healthcare organizations should develop a term of reference manual as an internal reference playbook?
Yeah, I've seen the question. I would say this is a very much best practice that would align with the good data governance practice. So definitely developing such terms of references would align with the data governance principles and lead to best practices from data governance perspective. So I would definitely agree. Yes.
Yes, and Professor Najib Azhar from San Francisco is asking about something. I don't know to what extent this is we suffer from this in our region, which is identity theft. Can identity theft of healthcare data, can it be an issue?
Yeah, of course, I would say an issue. Like I said, I mean, data governance has many elements beneath it, and each element will have its own dedicated professionals and personnel. Like, for example, the area of identity theft, this falls, and of course, under cybersecurity and falls under identification. So data governance will definitely address this. And like I showed before, the many data governance failures happen. This is mainly due to, I would say, weak cybersecurity and ultimately the vulnerabilities in their cybersecurity and their data governance, I would say, processes. So definitely if someone will implement data governance by using the best practice, definitely will focus on cybersecurity and definitely should focus on this digital identity theft.
Okay. This might be the last one. I'm not sure if you have addressed this or not by Mr. Ali. Now you have talked about data governance at a national level. Now he's asking about hospital level. How can we make sure that our hospital strategy includes governance elements at hospital level?
Yeah, that's a great question. So he's exactly right. The one we developed is for the national level. Now, what would I say is that each organization should develop their data governance, and this is actually a requirement from SDAIA. Each sector will have a national data management office, and this data management office will actually coordinate and assist hospitals in developing such data governance model. So this is an activity that is actually should be taken care of and should be performed from the different organizations. And of course they will always leverage the national governance model along the way.
Thank you so much, Engineer Tariq. We are really grateful that you took the initiative to be our first speaker in the e-healthcare leader. It's very evident that you have a wealth of knowledge and experience in this area. The topic is very important, and it's a hot topic, and we are very glad that you shared your experience with us tonight. Some of the participants are asking whether you will be able to share the slides even in a PDF format.
Absolutely, and I'm very honored, pleasured, and I'm very happy for the audience attendance and their participation and questions. It was really excellent, and really thank you, Mael Medina, for inviting me again. That was really a pleasure for me.
Thank you. Today is a Friday, and we have picked the Friday because we thought this is the most suitable day for doctors, because usually they work 2 shifts. So we apologize for choosing this time. We have more than 1,000 people who signed up for this event. Some of them did not make it, did not show up. And we will send a copy of this, the link to the video and the PowerPoint presentation once, Engineer Tariq Hakim share it with us, to anybody who has signed up for this event. I would like to remind you again that MILE is a non-profit institute in Medina. In March 19th to 24th, we will be offering our 5th high-performance healthcare organizations leadership development program. It's a very intensive 1-week training programs. We started this series of webinar, and we would like to invite people who are attending with us today, if they have in mind any recommendations about a speaker or a topic which is very relevant to innovation in healthcare and technology in healthcare, we'll be very happy to include them in our calendar. Even if it takes that we offer 2 webinars per week, we'll be happy to do this. Just please share with us, send a message to the host and panelist with any recommendations you have of speakers that you would like us to invite. Also, some participants asked if we have CME hours. Unfortunately, we didn't manage to get them. Again, most of the participants today are from the healthcare community. I would like to invite whoever can assist us in speeding up the process of getting CME hours for the webinars and for our leadership development program for healthcare leaders. This will be a great support to us. Certification, yes, we can issue certification for tonight's participation, but there will be a very minimal, fee, because MILE is a waqf. We are an endowment, and any nominal, contribution will be really appreciated. Again, I would like to remind you that this event was sponsored by tip.com, which is an online health medical community and online virtual clinic. Also, the second sponsor is Digitum, and they are technology solution developer and providers, not only in healthcare, but in many other areas. This is the draft of the calendar of the upcoming events. This is Dr. Najib Azhar, which we just posted the last questions from San Francisco. Critical resources for an effective response to healthcare crisis. We have digital clinic, analytic journey in healthcare, artificial intelligence in healthcare, capacity building in healthcare, operational excellence amid COVID crisis. There are so many topics that we will be addressing during the next few weeks. So stay tuned for these events. And if you have other suggestions, we'll be very happy to listen to your suggestion. Once again, we would like to thank Engineer Tariq Hakim, and I would like to thank all of you for spending this 55 minutes with us during our events tonight. And I look forward to see all of you joining us, inshallah, next Friday at 8 o'clock. We'll keep you posted, and we'll send you, an announcement